Hi friends! So today I just wanted to give you a little introduction about functional medicine. My goal is that everyone watch this video before they join the practice, before they come in for the first visit, just so that our expectations are clear, both my expectations of you and your expectations of me. So I just wanted to start by mentioning that um, in functional medicine, the diet and any alcohol that you're drinking, this really is the core of a lot of our treatment. So there's a lot that I can do with supplements and vitamins and herbs and even pharmaceuticals or compounded medications. There's a lot I can do with lifestyle changes. There's a lot I can do with testing, but it's very challenging if your diet is a pro-inflammatory diet for me to counter the inflammation. So I suggest that everyone try an anti-inflammatory diet. It doesn't have to be perfect, but any effort that you can make to eat foods that actually calm inflammation is helpful. Typically, this does mean gluten and dairy are out. We can talk about ways to do this so that it is healthy and so that you don't lose your mind. We also need to talk about caffeine intake and alcohol intake. And then we need to heal the gut. So, traditional pharmaceuticals can often cause gut inflammation. I'm going to do another video on leaky gut just to remind you of what that is or introduce you to what that is. But suffice to say that a lot of times stress and toxins and pharmaceuticals and our diet and hidden food allergies as well as chronic infections have actually caused openings in the gut that we call, or the intestine, and we call this leaky gut. So we need to address this. We also need to check hormones and balance your hormones. Both men and women need all of the hormones present, not just the sex hormones, but also thyroid, growth hormone, all of them. Interestingly, a lot of people don't realize that head injuries can cause problems in the pituitary, including growth hormone issues. So we talk about this in the first visit. We also talk about underlying autoimmune diseases and what has caused them, and mineral deficiencies if they have not yet been addressed. So stepwise, we really do start with food, lifestyle, and then we go to trying to remove some of the pharmaceuticals. So treating things like high cholesterol and high blood pressure in different ways. Then we check hormones, balance hormones, check minerals, balance minerals, and vitamin deficiencies. And then finally, we really need to address toxin overload. And oftentimes, getting rid of heavy metals is actually the last step because we need to make sure that both your gut and your liver are healthy enough for this step. So it's really important to note that lifestyle modifications such as sleep hygiene and stress management come into play at every step in this process of functional medicine. Sometimes this takes a year, sometimes it actually takes 2 or 3 years. Many times patients actually do really well in the beginning and they recover from these chronic illnesses like high blood pressure and high blood sugar and even autoimmune conditions, but they relapse and these things come back if they leave the practice and they go back to their own ways or their old ways. So basically what we're working on is also a little bit of a mindset shift and a lot of self-care techniques. Because I'm also a yoga teacher, I ask that you stay open-minded to ideas that I may have regarding yoga or meditation. I'm not going to give you some crazy, sweaty, hot yoga routine that's going to knock you out. That is not at all the way that yoga works. Yoga is more of a lifestyle than it is actually a practice that you go to the gym to do. And keeping in mind that your daily activities, if they're very stressful, then using something like yoga or meditation as a fire extinguisher to put out the fire, it's just not going to work. It's very important that we are on the same page in terms of our goals. Our goal is to help you be calm and peaceful and healthy and happy. And if that sounds great to you, knowing that it's a little bit more work than the traditional care where you get a pill for every symptom, then welcome. I look forward to meeting with you. It's definitely important to be honest with yourself and with me if you're just not ready yet. It's okay. Thanks so much.